Last but not least, we have Dr. Monica Cations speaking. She's a provisional psychologist and epidemiologist at Flinders and currently holds a Hospital Research Foundation's Early Career Fellowship. She's going to talk about a rehabilitation approach for dementia and psychological well-being.
Thanks, Lee Faye, and hello everybody. I'm so thrilled to be here with you all tonight to talk about psychological well-being and for people with dementia and the role that psychologists, counsellors and other mental health professionals can have in delivering rehabilitation programs for people with dementia. So thanks for having me. So, you know, I'm sure I'm not saying anything that everybody here doesn't know when I say that dementia symptoms and diagnosis can have quite a profound impact on a number of very important psychological constructs, including self-identity, you know, the idea of who I am as a person, working my way through the world. Dementia and the symptoms can affect a person's sense of control over their life and their environment, over their own control over their own brain. A sense of status and autonomy. Dementia can affect hope and plans for the future. You know, we know people with dementia tell us that their hopes and plans have to change, you know, quite a lot after they have a diagnosis. Dementia can affect social relationships in terms of the symptoms themselves can change the relationships, but also the stigma associated with dementia and the difficulty continuing friendships and continuing relationships, and the roles that we have within our family and friend systems can change. We also know that dementia can impact our ability to regulate our emotions. So that is our ability to calm ourselves down when we become distressed or angry or, you know, whatever other, you know, aroused kind of emotion we might have. And then of course there's all the economic and other stresses that can come with dementia as well. And so it's not surprising then that around about a quarter of people with dementia meet criteria for a major depressive disorder, and about 15% meet criteria for one or more anxiety disorder, which is much, much higher. These numbers are much higher than the general population of older people out there. And we also have emerging evidence that people who have experienced traumatic events in their lives and may have experienced some post-traumatic stress symptoms, those symptoms can re-emerge after the onset of dementia, even if they have been dormant for many years. And so that's an important and kind of underappreciated phenomenon that can happen. So despite this, very few people with dementia are able to access psychological or other mental health support. And partly that's because of a lack of workforce expertise. There's really not a lot of therapists, counsellors, you know, or even funding available for mental health professionals to work with people with dementia. But I also think that another reason for this is that therapeutic nihilism that Kate Swaffer alluded to earlier or talked about earlier, about this idea that people with dementia for some reason aren't able to participate in therapy or in counselling, or won't benefit from those services for whatever reason. And this idea that I think a lot of people have, or a lot of professionals may have, that dementia automatically means a person with very severe impairments, you know, living in a certain way. And of course we know that that's not true for most people with dementia. But if we can support people with dementia and their families and friends, what we also know is that dementia can be an opportunity for psychological growth, a sense of building resilience in the face of changes that can be very challenging. Role changes that happen within the family and within the community can be very meaningful, and new roles can be very meaningful. People with dementia are the best at problem solving of anybody I've ever met, because every day is a chance to solve problems. So, you know, the incredible problem solving skills that people can develop. And also it can be an opportunity for deeper social connection if a person has the opportunity and the support to make that happen. And so, you know, on the background of this idea that maybe psychological therapy doesn't work for people with dementia or isn't worth it, you know, what does the research say? Well, it says it works. So cognitive behaviour therapy is the gold standard frontline treatment for depression and anxiety for the general community. And we have systematic review level evidence to tell us that cognitive behavioural therapy is effective for treating depression and anxiety in people with mild to moderate dementia. And there are other manualised therapies that are helpful too. Problem-focused therapy can help people with dementia and their care partners to learn these structured problem-solving skills, which can become very important with the onset of dementia. Validation therapy is not so well known as a therapy, but has a real focus on validating the very natural responses, the natural feelings that we have when our abilities don't match our goals. It's normal to feel distressed by that. And sometimes we need support to sit in those feelings and allow ourselves to move through those feelings. Third wave mindfulness approaches can help us to sit with a feeling, accept and adjust to that change, taking our attention away from worrying about the future or ruminating about the past, and being present in the present moment can be quite therapeutic. And then of course your more generic, counselling services, support groups are just essential and have a huge impact for people's quality of life and their sense of social connection as well, which we know through DAIs, support groups, through living with dementia programs that we have here in Australia and I'm sure similar programs overseas. So when we talk, when we're talking to therapists about making this work, I mean, of course, adaptations need to happen because dementia causes disabilities and in some ways we need to accommodate for those disabilities in therapy. So we say to therapists, it's very important to be mindful with goal setting. Remember that cognition or symptoms will progress over time. That is the nature of dementia. So sometimes stabilisation is a great goal, and being very frank and open with the person that you're working with about what their challenges are and how they might be changing between sessions so that you can adjust your goals accordingly. Most of the literature tells us that behavioural strategies are more effective for people with dementia than your classic cognitive therapies. So this is things like activity planning, monitoring mood, behaviour experiments, which I'll talk about in a minute. Problem solving and learning those skills for problem solving are really important. Not everybody is born with a natural ability to solve complex problems. And so explicit teaching can be very, very helpful. One thing that's very important is to tackle dementia-related beliefs. So, I talked before about the impact that stigma about dementia can have on a person's social connections. But people with dementia themselves can also have dementia-related beliefs that are not helpful. We walk through this life with our experiences that shape our beliefs, and some people with dementia may have certain feelings and beliefs about what a person with dementia looks like and what that means for them. And if that belief is unhelpful and contributing to their psychological ill-being, it can be very helpful to do some work to challenge those beliefs. Of course, things like repetition and modelling and memory aids can be important if memory loss is an issue for the person, or whatever their symptom may be. Just be creative in working together to come up with accommodations. And you may consider co-therapy. So that is introducing a care partner or a loved one into the therapy room, but be very careful about this. Remember that the level of intimacy and the level of support between a person with dementia and their care partner can vary enormously. And assuming that the person automatically needs a care partner in there with them can really undermine the person's autonomy and their individual agency. And it can really threaten the therapeutic alliance right from the beginning. So be very upfront about this, have a discussion about it and get consent before you go down that road. And so for people with dementia who might be listening tonight, who might be thinking about seeking some support for their mental health, their psychological well-being, I really can't encourage that enough. Don't let anybody tell you that counselling, support, mental health services are not effective for you, because that's just not true. And it may be a case of trial and error. Just like every other person who accesses mental health support in our community, some therapists will work better for you than others. Some services will work better than others. So sometimes you have to just keep trying until you find the person that will work best for you. And testing out your unhelpful beliefs is a really good idea. So, for example, if you think that your friends will abandon you if you tell them about your dementia, and that's keeping you from being engaged in the things that you like to do, test it out. You know, don't let this unproven belief keep you at home. Do an experiment, try it out, see what happens. If you're right, you're right, but maybe you're not right. And maybe that's that barrier that's keeping you from being engaged can be overcome. Always trying to solve problems as best you can, being creative about trying new things, and remembering that the goalposts might change regularly. And certainly I can't even imagine the frustration of that, but being adaptable and, you know, every day putting on your problem solving armor can be a really empowering thing to do, I think. And just be kind to yourself. Remember that these feelings that can come with a diagnosis of dementia, changing symptoms, can be very, very challenging, and that people like me who do not have dementia, we can't possibly understand what it must be like. And talking to other people who have dementia or other care partners can be really important for normalising and validating those feelings. And medication can help too. So talking to your GP about that can be helpful too. Just very quickly, you know, I don't want to forget about care partners, because, you know, we know that supporting a family member or a friend with dementia can be every feeling in the world all at one time, times 1,000. Like, we know this, but, you know, it can be satisfying and also so frustrating, and also so challenging, but also so rewarding all at once. And again, that's a normal reaction to this kind of illness. But again, psychological therapy is effective for treating depression and anxiety in care partners as well of people with dementia. For therapists or mental health professionals who are working with care partners, it's very important to remember that life can be unstable and chaotic and unpredictable when you're caring for a person with dementia. And, you know, Kate Laver just earlier showed a picture of that hierarchy of needs. And, you know, it's very hard for a person to have their psychological needs met if they don't have stable housing, or they don't have enough money to put food on the table, or they don't feel safe at home with the person that they're caring for. You know, these are essential needs that it's important to work with other services to meet those needs before kind of moving on and stabilising the person's life before moving on to other things. So thank you so much for having me.